I'd just like to firstly welcome everybody this evening. Thank you so much for being here for another Let's Talk Period community session. This is our second community session now, and I'm really excited to be joined by Rhiannon Romanak this evening, who is a registered psychologist who has a special interest in endometriosis and chronic pain. Let's Talk Period community sessions are a chance to come together and hear a little bit about something relating to chronic illness, life living with endo, adeno, or PCOS, and hear from a professional in a sort of a more relaxed setting and just have a nice, safe space to get information and then ask those questions that you might not get a chance to ask or feel comfortable asking in other settings. So chance to walk away with some extra knowledge in the comfort of your own home, and then also just be around other people who also get it. And it is just so exciting to have Rhiannon here this evening to chat about all things stress, fatigue management, and pacing. So one of the biggest symptoms that I hear a lot about when it comes to life living with endo, adeno, and PCOS, and something that I also suffer from, is fatigue, and I guess managing the energy requirements that come with day-to-day life when living with a chronic illness. And so I think being able to hear a little bit about how we can adopt some strategies and things that we can do to help, I guess, function the best that we can is really exciting. So I'm going to hand it over to Rhiannon. If you do have any questions, just make sure you pop them in the chat and we'll get to them at the end. That just allows us to sort of keep the flow going. And if you have anything throughout, feel free to send me a message. Either you can message directly to me or you can send a message to everyone in the chat, up to you. But yeah, I will hand over to Rhiannon.
Thank you so much for that lovely introduction. I'm so excited to be doing this today. It's one of my favorite topics to advocate around. So thank you for joining, everyone, especially on a Monday night. Very brave. I'll just share my slides, so just bear with me. Okay, so like Isabella was saying, I'm talking a bit about pacing, stress, and fatigue today as it relates to, chronic illness, particularly PCOS, adeno, and adenomyosis. I just want to talk a little bit around what to expect from today. So Isabella did a brilliant job at kind of setting the scene, but I did want to flag that, yes, I'll be speaking on these topics today from a psychological perspective, as I am a registered psychologist. However, this doesn't substitute for professional mental health guidance or therapy. So I'll be speaking really generally today, but this is not at all tailored specific to you. So just keep that in mind. I thought I'd mention to you, as this is recorded today, if you do have any questions or wish to share anything, just keep in mind it's not confidential, as this will be probably posted on YouTube. So yeah, just make sure to have that in mind. So I thought we could start by just defining these things as a little reminder. I'm sure you're all aware, but a nice way to start. So endometriosis is defined as a chronic inflammatory disease in which tissue similar to the lining of the uterus grows outside the uterus. Adenomyosis is a condition where cells similar to those that line the uterus are also in the cell wall of the uterus as well. And PCOS is a hormonal condition that can cause hormonal imbalances, irregular periods, excess androgen levels, and cysts in the ovaries. And I guess the similarity there between these conditions, number one, they're commonly co-occurring, but also there's increased levels of stress, anxiety, depression, and something called PMDD, so premenstrual dysphoric disorder. So a lot of kind of mental health difficulties, along with these conditions as well. So that's just a way to kind of set the scene today and understand what we're really focusing on. I thought an interesting fact to share that maybe people might not be aware of is that neurodivergent individuals, so those with ADHD and who identify as autistic, actually have a higher likelihood of experiencing persistent pain and chronic illness across all organ systems. So there's actually higher rates of, things like endometriosis, PCOS, for neurodivergent individuals. I just thought that was an interesting fact and something to keep in mind when you're thinking about fatigue and stress. So like I was saying, there is increased levels of fatigue and stress for these conditions. And I guess there's a lot of reasons behind that. So number one, I guess the journey alone just to get to a diagnosis can be incredibly stressful. Individuals face things like, medical misogyny, feeling medical gaslighting's occurring when they're trying to, seek support and diagnosis for the symptoms they're experiencing. I guess the nature of these conditions, there's imbalances for hormones and inflammation in the body. That's naturally going to increase stress, and as a byproduct, pain as well. And I guess when we think about stress, it does have a role in our lives. So stress can be a really powerful motivator. It can make sure that we kind of get things done on time and, do things that need to be done. Without stress, we probably wouldn't get anything done. So it's incredibly helpful in that sense, but it also isn't so helpful when it's persistent or acute. So one way to think of this is, say if there was, a lion in front of us, of course, our bodies are going to ramp up into that fight or flight response, and the sympathetic nervous system would be activated. So that's our kind of go response in the body, where we're either going to fight off the danger or run away or even freeze. Definitely helpful if there's a lion there, but if it's something like, I don't know, a work deadline or something coming up that's worrying us, that stress response in the body is actually not so helpful because it can bring about symptoms like, increased irritability, I should say, difficulties concentrating, tension in the body, changes in our breathing. So you might notice you have more rapid breathing or shallow breathing, just like you can't really quite get a deep breath in. Some people experience headaches. Fatigue, again, is a really big one there. Difficulty sleep, so that can occur in a multitude of different ways. That could be difficulties falling asleep, staying asleep. It could be insomnia, so just not sleeping at all, and also just waking up in the morning around like 2 or 3 a.m. Particularly if you're waking up at those times, that's, indicating there might be high levels of cortisol, which is related to stress, so not great. Changes in appetites and digestion issues are also a really common one for increased stress, and then feelings of overwhelm. So not great, again, if these are happening, a lot in our lives and are persistent. And by nature, having these conditions means there unfortunately are increased levels of stress, and as a byproduct, that's going to cause, more inflammation, dysregulation in our bodies, and exacerbate pain. I wanted to speak a little bit on the luteal phase as well. So for those who do have a uterus and go through the menstrual cycle, this is really relevant. So the luteal phase is associated with less tolerance to stress, increased mood swings and fatigue due to the rise in progesterone and drop in estrogen after ovulation. So I thought that was interesting because I guess the luteal phase can be quite rough as it is, but there really is these physiological impacts and mental health impacts associated with those hormone imbalances there. So this is a time where you're not going to feel your best at all, and something to keep in mind. I guess if you are trying to put management strategies in place around managing stress or fatigue. Along the same lines of neurodivergence, I thought this was really relevant too. So those with ADHD may also feel like their ADHD symptoms actually worsen during the luteal phase. Medication actually doesn't work as well for women who are in their luteal phase or those who were assigned female at birth. And dopamine levels drop during the luteal phase too. So that's our kind of reward system of the brain that feel good neurotransmitter. So yeah, if you are neurodivergent and have any of these chronic health issues, you're gonna feel it extra in this time, but it's kind of rough anyway. So I thought I'd mention that. It's just important kind of knowledge is power to understand yourself and what's going on. So on the kind of topic of fatigue and stress, there is something called the boom and bust cycle. Some of you may have heard of this, some might not have, but it's essentially a cycle where if you have, chronic illness, you might, conversely have a disability or something that's really impacting your functioning day-to-day life, that you do have this tendency to go through that boom and bust cycle. So the boom is, as you can see at the top there, the red part here. Great, I'm actually having some energy today. I'm feeling a little bit better, or maybe the pain's not as bad, or I feel I've got a little bit more capacity. So I'm going to do everything on my to-do list and everything that I need to catch up on and go, go, go. Yeah, maybe that in the moment feels like a good idea, but overdoing that actually creates more pain, more stress, can worsen symptoms around mental health like anxiety and depression because it's requiring more rest to actually recover. So you're kind of shooting yourself in the foot by doing that. So the idea is, if you're aware you're doing this boom and bust cycle, by overdoing it when you do have a little bit of energy, that knowledge is power, right? So you can do things to prevent that. Before you can even kind of get into the management side of how we prevent the cycle from happening, it's important to get to a place of acceptance with whatever condition might be impacting you. So I don't say acceptance in the sense of you have to be okay with what's going on. It's more around, okay, this is acceptance around what my situation is for right now. These are the symptoms that are impacting me. This is what life looks like. And maybe for the foreseeable future, this is what things kind of need to be like for right now. So there's definitely a grief process that can be attached to that and some really difficult feelings. It is a bit of a roller coaster, but that acceptance is key, because if you can't accept kind of what things are like right now for you or what you need, you're not going to be able to put in place a realistic management strategy, because maybe your expectations of yourself are too high, or you're comparing yourself to others, or you're just not practicing that self-compassion and maybe being critical. So that acceptance is really key, I think. Yeah, in order to have a realistic, helpful, adaptive management strategy. And if acceptance is something you're struggling with, of course, I encourage everyone to seek, mental health support, or turn to their support system, friends, family, or the Let's Talk Period community if they need to kind of work through those feelings, because they're hard. Pacing is one of the management strategies. So pacing is essentially what I was talking about before. You go into that boom cycle, you try and do everything that you don't get to normally do, maybe when you don't have as much capacity or energy, or you're in pain, so you can't do those things. But pacing is being really mindful around, okay, what is my baseline normally like, and what can I do to make sure that I still get some things done, but I'm not burning myself out and still have some energy left over the next day. So pacing is the idea that you pace yourself, your work, and your daily activities to prevent entering that boom bust cycle. Daily activities can be things like, having a shower, making breakfast, going to work. Really anything that you do to function during the day. Important to create a realistic plan for your day that incorporates self-compassion and rest. So rest is a really important part of productivity. It kind of seems counterintuitive, but if we don't rest, we're actually, again, going to burn ourselves out, make fatigue worse, increase our stress. It's just not good for us or our bodies. It's important as part of this plan to identify what your warning signs are that you're overdoing it. So that could be warning signs around your mental health, maybe your feelings or emotions, or how you're behaving toward others or yourself. It could be physical signs. Again, those signs of stress are like headaches, like tension in your shoulders or your body, sleep difficulties, irritability, things like that, that can kind of pop up to indicate burnout. Identifying potential triggers as well can be a really good idea. So if there is anything coming up in your life that could be causing extra stress potentially, or just being a big change, whether that's a positive change or a difficult change, that can all increase stress, inflammation in the body as well, and can be kind of difficult to manage, even if it is a good thing. So just, keeping that in mind as well, just being really mindful of what's coming up for you. It's important as well to have a bit of a backup plan. It doesn't have to be written out or anything, but just knowing in your mind what you would do to manage potential pain flares or mood changes if you are feeling particularly stressed, or like you have less capacity to do things you'd normally do or get the things done that you need to. This could look completely different for everyone in terms of that pacing. So I'm not going to give an example of what that would be, but just thinking to yourself, okay, again, what do I have capacity for today? How am I feeling? Take a moment to be mindful and check in with yourself. And with a lens of self-compassion and kindness toward yourself, think about, okay, what do I really need to get done? And what can kind of go to the wayside for a little bit? What can I put aside so that I get done when I need to, but I'm not overdoing it. And then you're preventing that burnout cycle. So pacing is a really important thing to keep in mind. There is something called spoon theory as well, which is really relevant to those, again, with chronic illness or even disability too. So, and we know that, these symptoms that we've talked through can be really disabling. But spoon theory essentially is a metaphor created by Christine Missandino, I think you pronounce it. So these spoons represent units of energy, and the theory posits that individuals with chronic conditions have a limited amount of energy represented by spoons each day. To give an example, maybe someone without chronic illness has an infinite amount of spoons, so they can, get up in the morning, brush their teeth, they can shower, they can go to work, get a full day's work done, work full time, come home, make dinner, do some cleaning around the house, get a good night's sleep. They have that infinite amount of spoons to get everything done, whereas someone with a chronic illness, for example, might only have 12 spoons, and each thing they need to get done during the day might have a different amount of spoons and energy units that it uses up. So, for instance, someone with chronic illness getting out of bed, that's already a spoon. That's one. Having a shower, that could be 3 spoons. That could be really hard for that person. Going to work, that could be 6 spoons. Even making a meal, that could be 2 spoons, for instance. So it's different for each individual, but it just shows that by default, those with chronic illness, things like, endo and PCOS, yeah, there's less spoons, and by definition, you have less energy than the average person. So that can help with acceptance too, just understanding, wow, I really do have less energy. These symptoms can be really disabling and impacting my functioning in a really detrimental way. And I really need to be careful around how I do exert my energy and where I use my energy in the day. So a lot of people find spoon theory really helpful. If it's helpful for you, you can give it a Google, and there's some free templates online that you could look at and kind of incorporate into your daily routine to try and prioritize certain tasks. And again, what you can put to the side and what you need to prioritize. But yeah, spoon theory can be really helpful to incorporate into that pacing management plan that you can create for yourself, or in line with a therapist if you do seek therapy. There's some examples there, like I was talking through. So you can see getting out of bed, reading, studying, socializing, even uses spoons, driving, attending social events, even watching TV. So yeah, I think that's important to think about, okay, how much energy is that actually using for me, and is it necessary? Now we're kind of moving into some strategies around how to manage fatigue, stress, and burnout as it relates to chronic illness. I think it's really important to mention that self-criticism actually hinders self-compassion. So we were talking earlier around maybe some of the comparison that can happen, that can hinder acceptance or actually pacing our day and looking after ourselves. So it's tricky. It's tricky in society to practice self-compassion, because by default, in a Western society at least, we're, taught from a really young age that we need to hustle, we need to be busy all the time. That's what's valued. That's seen as success and productive. But that's just not the case. And success and productivity looks different for each individual. And again, rest is really important as a part of that picture. So self-compassion is like a muscle. We do need to practice it and build that skill, because it's not ingrained in all of us, okay? We're not all taught how to use this, and that really comes down to our early life experiences in childhood, our families, how they viewed compassion, during our schooling years, growing up, our workplaces, how that's kind of perceived. That all influences how we perceive it and how we treat ourselves. That can also impact automatic negative thoughts that might pop up in our minds, or unhelpful thinking styles too. So if we aren't kind of taught how to be self-compassionate, we're more likely to be critical toward ourselves. So we have to kind of unlearn some of that, which is a process. So like I was saying, just like a muscle, we need to practice it, practice it every day, build that muscle up, and eventually it will get easier. But like I was saying, some of the things that can hinder or make it more difficult to be self-compassionate is, like I said, our early life experiences, our body's response to stress. So again, when we are stressed or experiencing pain, or those hormonal imbalances, it can cause that fight or flight response in the body. So naturally, our body's already in that survival mode and tense, on edge, not in the space, I guess, to be the most self-compassionate or kind of think rationally. We can be in that emotional mind. So if we're already in that state, of course, it's going to be more difficult, right, to practice self-compassion. Our body's kind of in that threat response. We might lack awareness. It's, I guess, not something everyone does, is to just take a moment and like really understand, how am I talking to myself? How am I treating myself? So it's something that we have to build as well, taking, that time to really check in and be like, okay, how am I actually responding to this situation to myself? For instance, if there's a pain flare and I need to cut back on tasks, or if I'm just having a particularly difficult day, my mood might be really low, or I might be really anxious. How am I responding to that? And where's that coming from? Is that actually what I think and what I would tell a friend? Or is this, again, because of those early life experiences or what society kind of views as success and what I should be doing? A lot of should statements can come up in these unhelpful thought patterns. Again, beliefs and views around self-compassion, we've kind of touched on that already with, workplaces, society. I think particularly those who identify as women experience a lot of difficulty around being self-compassionate. There's a lot of, I think, shame associated with not living up to what society views as the standard of a woman and being able to do all the things a woman should do. Just stereotypically, that could be taking care of a home, making sure everything's clean, being able to handle family life and have a full-time job. There's so much kind of expectation there on women. And also to be kind of pleasant and palatable as well and not like show that distress or that anger. So yeah, we've been conditioned to be a certain way. Yeah, it's really important to unpack that as well and think, okay, maybe I do deserve to be angry. Maybe I need to scream into a pillow, or I need to say, no, I actually can't attend that. I'm going through a lot right now. It's okay to say no to things, but we're not always taught that. So yeah, it's really important to consider those beliefs as well, to try and be more compassionate with yourself. And then just comparison, like I was saying, comparing yourself maybe to those who aren't experiencing chronic illness. Maybe they're at a different timeline in life than you are. Or maybe you had expectations for yourself. Again, that's society's expectation too around where you should be in life at this age and those milestones. So I guess ways to limit comparison is just remember that comparison is the thief of joy. You're really not doing yourself any favors. It's really going to hinder your acceptance around what your situation is right now. And that, again, it's not about being okay with it, but it's just acknowledging this is what it is for right now. I need to accept it for what it is for right now and manage it. Social media can be a great place to start with that and cull. We talked about this on the podcast, just culling anything that doesn't make you feel good, or is kind of bringing out that feeling of, I guess, envy or comparison in yourself. Another strategy that's really, really helpful for fatigue and stress is mindfulness-based strategies. You've probably heard the term mindfulness thrown around a lot, but it is evidence-based and scientifically proven that mindfulness strategies actually rewire our brain to be more resilient to stress. So this is really one of the most effective ways that you can not only set yourself up to prevent, I guess, acute persistent stress, but just really looking after your body and switching on the calming response in the body, which is called the parasympathetic nervous system. So again, that's a skill. So you learn to kind of use that more and more, and it'll be easier the more you do it. But mindfulness is, again, a skill. It's not easy for everybody. Some examples of mindfulness, of course, the probably most obvious one is guided meditation. Some people really enjoy that. But other forms can be mindful walking. So just being really present while you go for a walk in potentially nature, somewhere you enjoy. Mindful eating. So just being present, not on your phone or anything, just sitting there really grounding yourself as you're eating, noticing the taste, the feeling of the food, the texture, the smell. Mindful coloring in and drawing can be a really good one. If you need to be kind of doing something, it's difficult to sit still. Yeah, and I guess if there is any, neurodivergence in those listening as well, things like, sensory aids while doing mindfulness activities can be helpful. So they could be fidget toys, or deep pressure is helpful. So maybe a weighted toy or blanket while you're doing these activities. That can help regulate the nervous system too. So yeah, I would really encourage mindfulness for anyone who's open to it. But again, if that's tricky, of course, encourage seeing a mental health professional and, getting support, integrating strategies that are tailored to you. The next one is behavioral activation. This is a psychology term we use when we're treatment planning for people, but really this is a strategy to manage, I guess, those who are going through really low periods or fatigue and finding it really difficult to do anything. Like maybe they're not enjoying things they used to enjoy, just finding it hard to kind of be motivated and get things done during the day. Even things like socialize, even the fun things. So the idea is that when you're considering your management, your pacing, kind of plan, to incorporate one thing in the day that brings you joy and one thing that brings you a sense of fulfillment and like achievement. So it doesn't need to be quantitative in the sense of, oh, I need to get a full load of washing done and hang it out, and then that's it. That's my sense of achievement. It could be just 5 minutes. I'm going to set a timer for 5 minutes. I'm going to try and maybe fold some washing and leave it at that. It can start small and then you can build yourself up. But the idea is that we need to use energy and start doing things to create more energy to combat fatigue and stress. So, oh, and that low mood, I should say as well. So something that could bring you joy, honestly, that's really individual. It could be anything. It could be stepping outside for 5 minutes in the sunlight, seeing the sunrise. It could be having a cup of tea. It could be literally just getting out of bed and maybe watching a bit of a TV show you like. It can be really small. And again, it's really easy to fall into that trap of, oh, I should be doing X, Y, Z, or I should be working out for an hour, or I should be doing this whole morning routine, but it's not about that. It's back to basics, really simple. One thing that brings me joy and one thing that brings a sense of achievement, and try and incorporate that every day, whatever that might be. So that can be a really helpful strategy to try and incorporate as well. And again, it's evidence-based. But if that's feeling a bit tricky or too much, sometimes in terms of executive functioning and being able to plan and organize things is really hard when you're fatigued and stressed and you've got chronic illness. So again, that's where a psychologist or a mental health professional might come in to actually help you, create a treatment plan and tailor that to you, so that you're not on your own going through that. So that was a strategy. I guess that's pretty much what I had planned for today in terms of the presentation, but I'd like to open it up to questions if anyone had any questions around anything that I've discussed, or if there's anything burning on your mind you'd like to talk about.
Quickly say just how insightful that was, Rhiannon, and I really liked the chat about, I guess, the self-compassion side of things and also acceptance, because I think it's a huge piece when living with chronic illness and you sort of fight it for so long. And I think when you do accept what's going on for you, you can start to be able to really work through figuring out how to best make your chronic illness work for you and what is going to help give you that sense of fulfillment and help you feel like you can achieve things even when living with chronic illness.
Mm-hmm. Definitely. I'm glad you found that valuable, and it's really true. Without that acceptance piece, it's like you're stuck in limbo really, and you can't move forward.
Yeah.
So you're really suffering. Mm.
Yeah, absolutely. Ellen saying she finds it hard to know what chews up more energy than others as well.
Mm-hmm.
And then also, I guess sometimes something might take less energy one day than what it does on a particular day. So I think it's about, and you can, I guess, talk to this as well, Rhiannon, but thinking about like sort of where you're at on any given day and sort of checking in with your body and how you're feeling on that particular moment.
Definitely. Yeah. And there is something they refer to in that theory called spoon debt. So if the day before you've used way more spoons than you probably should have, that's when you get into that bust cycle, I guess. And so you're in debt and you probably need to do more recharging, relaxing, downtime than you would have otherwise. So yeah, you're right. Completely can change day to day and can fluctuate based on your capacity or what's going on for you.
Does anyone else have any questions at all this evening?
Hi everyone. I'm
Hello.
Bernie. I just wrote a big thing in the chat, and then I think it's actually probably going to be easier if I just say it. Be brave and unmute and just say something.
Well, I'm proud of you.
Thank you. I guess I'm fascinated by the self-compassion notion, because it seems, makes so much sense. And I guess even engaging in a way where you can acknowledge that you have X amount of spoons in that day is a form of that self-compassion, in some ways. I guess that's just how I'm sort of piecing it together in my head as we go. But I'm familiar with the work of Kirsten Neff in that self-compassion space, but I find it really tricky to find resources around it or people who are experts in it. It's not super cringe and not Kirsten Neff. So I wondered if there were any other resources. I'm sorry to put you on the spot too, Rhiannon, like it's truly something we can follow up at another time, but I really am interested in reading more about it and understanding it further. Yeah, could you point me in the right direction there?
Of course. I'm just looking to the side because I've actually got a book on my desk called The Gifts of Compassion by Stan Steedle. And he's, I believe he's Australian researcher and clinical psychologist. And he talks a lot about compassion-focused therapy. So it's all about self-compassion. So I definitely direct you to him to have a look on his website, and his books is honestly amazing. And also Acceptance and Commitment Therapy by Russ Harris. He has a website full of free resources, audio mindfulness meditations you can do with yourself around self-compassion, and worksheets. So I'd really recommend him. He also has a book called The Happiness Trap that you could have a look at.
Yes, so I am familiar with that. That is a good point. I had forgotten him. Stan Steedle, did you say?
Yes, and I can send that to Isabella if we can pop it maybe somewhere for you guys to access. Yeah.
Yeah.
Thank you so much.
You're more than welcome.
I also have like a side recommendation to that. It's a book by Cara Eloff called The Chronic Pain Couple, and it's got different topics to do with living with chronic illness and I guess relationships, but it also, you don't need to be in a relationship to take the advice on board. And Cara also speaks about like the notion of getting ahead, but in that she has like a framework where it's like an acronym AHEAD, and it's sort of AHEAD, like the A is for acceptance, and then the H stands for something else, and then the E and the like it all sort of steps out different points, and it's to do with treating yourself with compassion whilst also getting ahead and trying to achieve what you're wanting to achieve, because it's sort of, you can feel trapped when living with a chronic illness. So I'll when I email everybody the recording, I'll also pop a link with all the different resources that we've sort of mentioned here as well, so everybody can have a look at those too.
That's brilliant. I haven't heard of that, Isabella, so I'll definitely look.
I'll send that to you as well.
Yeah, thank you. Something coming to mind as well around self-compassion is Brene Brown. She has a podcast and a million books. Chef's kiss, she's amazing. So anything from her, I think, will help you learn about self-compassion and practice that.
Yeah, there's some great conversations between Brene Brown and Kristen Neff that are pretty cool. Edi's podcasts, I think. I guess I've heard them on podcasts. Must have been amazing things. Yeah.
And yeah, thank you so much for being brave to pop your mic off and ask a question as well, Bernadette. I really appreciate it. If anyone else has any other questions, feel free to either pop them in or unmute yourself. We'll stay on for a little bit longer, and then we'll close for the night after that. But
something popping into my mind is you know, if you think about the start of your day when you wake up and you're, you know, thinking about what's on for the day, if you were just to take a minute to think, oh, how am I feeling, and like put your hand on your chest, show that self-compassion from that different lens, and maybe usually how different maybe the plan for the day would be. I just think that's really powerful. I try to do that for myself a lot more lately. But yeah, just that different lens and how that can really change the trajectory of the day.
I think that's a really good strategy. And I think if you are getting that feeling of, oh, I'm feeling really overwhelmed, then what can you take off your plate to sort of make yourself feel a bit more in control of the day and not so that feeling.
Yeah, definitely.
Yeah. Okay, well, if no one else has any questions this evening, then that is so fine. And as I said, if anything does come to mind, don't think you've missed your chance. Feel free to message me or contact Rhiannon. I'd just like to thank everybody for coming along this evening. I'd like to thank everyone who has registered and is watching this at a later date. Thank you so much for supporting the community sessions. And if you have any suggestions for future sessions or things that you'd like to hear about, like, please let me know. I'd also just like to thank you, Rhiannon, for your time this evening and for your support of Let's Talk Period as well. And I just hope everybody has found this a really useful session and can sort of, I guess, one, show themselves some more self-compassion, and two, take some of those strategies that Rhiannon shared to help with fatigue management and reduce our stress a little bit as well. So thank you so much for joining us tonight.
Oh, it's been a privilege. Thank you so much for listening to me.